In this video, I'm going to show you my 3-step approach to helping people solve their peripheral neuropathy nightmare. So, do you have any of these signs here, these 7 signs? Numbness, burning, cramping, electrical pain, pins and needles, pain while walking, balance problems. Do you have any of those? Many times, if you're at the early stages, you won't know that you have neuropathy. Maybe your feet are just sore. Maybe you feel like you're getting old. In my case, a couple years ago, I kind of thought my feet were out of shape, but they were getting unusually sore after I started training. And I also have been diagnosed with peripheral neuropathy. And I'm going to show you a 3-step approach. We're going to look at you structurally, metabolically, and neurologically, and how this comprehensive approach can give you, and the majority of you, probably 90 to 95% of you, success in reversing or even eliminating your neuropathy symptoms. Now, again, you want to find a natural approach, because if you're on any medication, you know that it might take the edge off, and sometimes that's necessary, but the reality is, talk to people that you know of that are on meds for neuropathy and ask them how's it working. And obviously, most of you that are watching this video are on medication. And obviously, if the drugs solved all of your problems, you wouldn't be spending your time watching this medication. As a rule of thumb, in my experience over the last 30 years, the drugs take the edge off. But over time, it takes more and more drugs to achieve the same result. And as you know, you guys probably know better than me, that there are many side effects with every type of drug. And the more drugs you take, you're probably going to have more side effects. So it's important that you find a natural solution. And I'm sure none of you want to have a surgery, and most of you would like to get off the drug. So pay attention to what I show you. We're going to talk about a 3-step method where we address the structural causes, the metabolic causes, and the neurological causes with peripheral neuropathy. So again, numbness, burning, achy feet. And sometimes it's odd because you kind of go back and forth between your feet are cold and sometimes they're hot. Sometimes you want to get the blankets off your feet. I completely understand that. I have that myself. So, and then some of you, again, you may not know you have neuropathy yet. Maybe your just feet are sore. You're at the beginning stages. So again, if you really want to get at the crux of the matter, if you want to not just treat the symptom, but get at the root cause, then listen up. I think this video will really hit home with you. And if you watch it to the end, you're going to listen to a patient of ours, Gene, that had tremendous results following our 3-step method, which is looking at you structurally, looking at you neurologically, and also looking at you metabolically. When we talk about metabolic, we're talking about diet, we're talking about lifestyle, and all those factors that affect inflammation. I'm Dr. Gregory Kramer. I'm a Livonia-based chiropractor. I'm a certified corrective care chiropractor with chiropractic biophysics. I've been in practice for over 30 years. I've seen over a couple 100,000 visits. I also are involved with Functional Medicine University. So we look at health structurally. My training deals with that. We look at health metabolically, looking at nutrition, looking at supplementation. Basically, we want to get good nutrition in, and we want to get bad stuff out. Okay, are you deficient in certain nutrients? And are you overloaded or toxic in things that are not good for you? So we want good stuff in, bad stuff out. And also we're going to talk about the regeneration of these damaged nerves, okay? So think of our approach as looking at you like you would look at a plant, all right? And if you had a wilted plant, you would ask yourself, what environment can we create to regrow the plant, all right? So a wilted plant, you might think, hey, is it getting enough sunlight? Is it deficient in sunlight? You would think of, is it deficient in water? If you don't get enough water to a plant, it's going to wilt. And you would think of, is it deficient in the soil or the nutrition that the plant needs? So the same thing. We have to look at damaged nerves the same way. We have to create an environment to stop the degeneration and start the regeneration before it's too late. Because peripheral neuropathy is a chronic problem. And that means if you don't fix it, if you don't start creating regeneration, it gets worse over time. So pay attention to the end so you can listen to our awesome patient, Gene, and therefore we can really reach out and have a nice conversation. When I say conversation, I'm going to give you some information at the end. I'm going to ask for some feedback from you guys. So again, we want to stop the degeneration, start the regeneration, and yes, peripheral nerves can heal. Okay, in the majority of the case, they can heal and they can repair yourself. So I look forward to sharing with you information that's going to stop the degeneration and start the regeneration. Now, I'm going to go in a little bit detail, a little bit of a big picture overview of the structural, neurological, and metabolic approaches to peripheral neuropathy. Now, before I do, you guys know what to do. Click the like button, like it, and share it, okay? And very simple. I have a little video for you at the end. If you watch to the very end, I got a little bit more information that I think will help you. Also, you can listen to what Gene had to say about our treatment approach. So again, we're looking at a three-prong approach to reversing this nerve problem. So neuropathy means suffering of the nerve. And we're talking about at the ends of the body, typically your hands and feet. Most people, it has to do, more common to do with your feet. All right, but you can have it in your hands too. So let's first talk about a structural approach. As a chiropractor, I specialize in the structural aspects of the human spine and how that affects your nervous system. So those of you, this is a picture of your spine, this is your disc, this is your spinal cord. Your spinal cord connects the brain to the body. Think of your spinal cord kind of like a safety pin. It's a two-way street. Your brain sends a message to your body sends a message back. As long as there's no interference, that means 100% energy or communication goes from the brain to the feet and 100% comes back, the body is designed to self-heal and self-regulate. Well, the problem arises that we're in a gravity-based environment. So falls, trauma, accidents, things of that nature can cause these vertebrae in your spine, particularly in your lower back, that can put some pressure or compression on the nerves. So the first factor with neuropathy is you always want to check the lower back, all right? So what we want to see is the disc. Is the disc nice and fat in the front? And this is the back part of the spine. This would be your spinous process. And is there space in the back for these nerves? So if we take an x-ray and there's not much space, that is a factor where the nerve is getting compressed. So your feet are not getting the messages starting at your low back, and you may or may not have back pain. Just like high blood pressure is a silent killer, just like cancer many times can be silent at the beginning, that you can have a compressed nerve where these bones are putting pressure on a nerve. You could also have a bulge or herniation. If you can see this right here, this bulge or herniation is hitting this nerve. Well, if that nerve goes to your feet, you're not going to get 100% of the energy. So if that's the case, what we want to do is decompress the spine. So this is a compressed nerve. So what we would want is to decompress. Okay? And so spinal decompression for a lot of people with neuropathy is a godsend. And so many times people have been on many different types of drugs, sometimes physical therapy for the feet, and they're not getting anywhere because they're not addressing the root cause. Remember, we're talking about your feet are just like a plant. And if your plant is wilted, we got to create an environment for that plant to self-heal. And one of the things that your plant needs is water. But if someone steps on a garden hose that feeds the plant, that plant will slowly wilt. Now, if someone takes their foot off the hose and the plant starts receiving water, does the plant spring back to life, or does this slowly come back? It slowly comes back. Particularly if you've had neuropathy for many years, it takes time to get sick, it takes time to heal. But we've seen some amazing changes when we decompress the spine, that people's legs feel better, those leg aches, those calf pains, and those foot cramps miraculously go away. So again, we have to look at a mechanical factor that influences neuropathy. And how we do that is with a standing x-ray, and even better is something called a motion x-ray, where we can see if those vertebrae are locked or frozen. pinching a nerve, affecting the energy from the brain getting to the feet. So again, number one is look at you structurally, okay? Number two is we're gonna look at you neurologically. So there's tests that we do in the office. It's called a Toronto scoring system, where we will touch your face and your hands and your feet. So in other words, let's say I have a very simple pinwheel. You guys been to the doctor and the doctor runs a pinwheel. Well, it should feel the same on your face and your hands and your feet. Same thing, if the doctor touches you with a cool piece of steel, like the handle of a pinwheel, it should feel the same on your hands, your face, and your feet. If we run a blow dryer real briefly near your face or your hands, it should feel the same. So that's one of the ways that we use to see, do you have some sensory problems with the nerves? And we can quantify that. All right, if you're at the early stages, maybe 10% loss, fantastic, that's easy. But if you're at the later stages, 50%, 60%, that's scary. I don't like to see anyone with more than a 20% loss. If you have more than a 20% loss, that is significant. You need immediate attention. You need to find a doctor that specializes in the natural recovery of neuropathy. And the easiest analogy is if the doctor talks about just putting on drugs to kill the symptoms or the pain, that's really not a holistic point. That's not going to give you long term. Yes, drugs can help you short term, but probably not long term. And don't take my word for it. Go talk to your friends. How many of your friends, their neuropathy is completely cured by a medication? Then in a year from now, 5 years from now, ask them, is it doing the same or do they have to up the dosage? So again, we want a good question is, if a doctor says to you, hey, let's look at your neuropathy like we look at a house plant. We need to create an environment for the plant to heal. Let's find out why the plant's not healing. If they talk to you in that tone, that philosophy, I think you found a great doctor. And then even better yet, you find a doctor that looks at you from a structural, a neurological, and a metabolic point of view. I think you have the highest probability for your body to heal and repair itself. So again, we want to look at you structurally, okay? Then you're going to look at neurologically. Is this nerve compromised? And there's things that you can do to help rebuild that nerve pathway, okay? And one of those is called a rebuilder. That's a piece of home equipment we use in addition to our multi-model approach. We take a multi-model approach in our office. Again, under the umbrella of structurally, neurologically, and metabolically. Now, metabolically is looking at you from a nutrition point of view. In a short answer, in a nutshell, we want to lower inflammation. So high blood sugar, one of the huge factors for neuropathy, very simple. Think of high blood sugar like your body, like termites eating the nerves. That's kind of what it is. So what you can do at home is start getting your diet under control. All right, start getting your blood sugar managed. So again, minimizing grain and sugar in your diet. Also looking at your gut. When we have chronic gut problems, reflux, heartburn, bloating, constipation, diarrhea, well, guess what? Anytime we have a gut problem, that affects chronic inflammation. And systemic inflammation plays a role in every aspect of your health, from brain problems, concentration, Alzheimer's, cancer, heart disease, joint problems, and last but not least, peripheral neuropathy. And if you have all three, a structural, a neurological, metabolic, you got to address them all. And that's really what you want to look at. And I'll dive more in future videos about a little bit more detail, but just think of this. Think of a couple key points. One, nerves can heal. Number two, don't wait till there's nothing left. All right, there's different degrees of damage of your nerves. So you want to see a doctor that does the Toronto evaluation. Number two, you want to see a doctor that looks at you, that addresses the cause and not just treats the symptom. So if they're only using drug therapy, they're really only treating the symptom. And I don't need to go into detail about that. I don't need to go into all the side effects. You probably know that better than I do. So we want to look at your neuropathy the same way we want to look at a houseplant that's wilting. We want to create an environment for healing. We want to stop the degeneration, and we want to start the regeneration. And we do that by decompression of the spine if that's necessary, taking pressure off the nerves. We want to rebuild those nerve pathways if those nerves have been damaged for a long time. And then we also want to look at chronic inflammation, controlling blood sugar, and also looking at our gut function. And I believe if you do that, you're going to have the best possible chance for success. You're going to see a patient of mine that had great results from our three-prong approach by looking at her structurally, neurologically, and metabolically.
This started 6 years ago, and I had cramping in the feet, calves of my legs, weak ankles, and when I walked, it felt like I was on a floor covered with crumbs.
Was there any pain in your feet?
And as time went on, I got pain in my ankles, radiating up my calves of my legs.
Okay. And how are you doing now?
The pain is totally gone. My sleep was interrupted almost on a nightly basis with Charlie horses, and that's greatly improved. It's not near as bad as it was. My feet, there's no pain.
What percent improvement would you say you are now compared to when we started?
When we started, I would say at least 90% better.
Okay. And was the treatment painful though?
No, absolutely not. To me, it's just been amazing. Just, do the stretches, the exercise, come in for adjustments, the rebuilder. It's all been very, very helpful.
Was the diet and nutritional program, was that hard to do?
It was absolutely not hard to do, and I can't even begin to tell you the benefits that I've reaped from the nutritional side. It's been wonderful. My energy is up 110%. I just feel more alive, and I'm able to keep up with hubby and the dog, so life is good.
What would you tell other people that are suffering with peripheral neuropathy?
You don't have to suffer. There is help, and it doesn't necessarily have to be in drug form.
Oh, good point. Did we use any drugs or surgery to help you?
Absolutely no drugs and no surgery, and that was what my draw was to this type of treatment.
Now, if you like this video, you know what to do. Like and subscribe, share it to a friend, very simply. And I believe if you're having trouble, that many of the doctors that do structural rehabilitation that are certified in chiropractic biophysics will also have a pretty good background in clinical nutrition and be able to help you and guide you with your neuropathy. So I think that's a great resource. Also, share with me. I've kind of told you my approach with neuropathy. I myself have had it. I've treated patients that have had it. But what have you done? Have you had shots? Have you had surgery? Some people have had their toes removed. Have you had medication? If so, how'd that go? Are you 5 years into it and you're on more than one med? Tell me, I want to hear this. Did medication solve all your problems? Maybe you're one of the few. I haven't seen that, but if you're one of the few, I want to hear about that too. Have you tried this three-step approach where the doctor you saw said, hey, he gave you the plant analogy, we need to regrow the plant, let's look at you structurally, let's look at you neurologically, let's look at you metabolically, and tell me how you're doing now. So again, let me know what helps you, let me know what your response has been to a variety of approaches. And again, like I said, if you have had a great approach, let me know. Now, if you want more information on the neuropathy, I have a webinar, and just click over here and you're going to see that webinar is there for you.